It's not a question of what is Gonstead, but who is Gonstead. The Gonstead system of chiropractic was founded by Dr. Clarence Gonstead, and Gonstead was a mechanical engineer before he studied chiropractic, and he studied chiropractic under the founder of chiropractic, D.D. Palmer. He applied his mechanical knowledge to the human body and formulated the Gonstead system. From this he got some great results, and he opened the largest clinic in the history of chiropractic in a country town in America. His clinic boasted a waiting room of over 100 patients. It had his own hotel and airstrip, and people flew from around America and around the world to come and see him. His technique was so popular, now it's taught in most universities around the world. At Chiropractic Solutions, we emulate this method because of the results he obtained. There are a number of steps involved in the Gonstead exam. The first step is to take a health history. This allows us to ask about your current problem, as well as to determine any prior issues of trauma and other issues that may be relating to your current symptom. The next step involves observing your spine and your posture, as well as your movement patterns. This helps us determine any areas that we think may be causing your problem. The next step of analysis is to use this instrument called the nervoscope. It is highly sensitive to heat, and when we run this down the spine, it looks at any temperature changes in the skin caused by the misalignment. The next step of analysis is called static palpation. What we do in static palpation is we feel around the spine, and again, when we have a misalignment, it can cause changes to the tissue where the ligaments and the tendons get damaged, and we can feel the swelling as well as the muscle tightness caused by the misalignment. The next step of analysis is motion palpation. This is the assessment of movement. So what we do here is we move the person around very gently, and we feel each joint in the spine, from all the way from the bottom of the spine to the top of the neck. When the spine doesn't move in certain areas, that can indicate misalignment. The last step of the analysis is to then take an X-ray of the whole spine in one picture. This helps us rule out any pathology and also to detect areas of postural weakness on the X-ray. We then put all this information together and this allows us to exactly identify where your problem's coming from. The Gonstead adjustment is so unique because what we're trying to achieve is to correct the only joint that's misaligned. So for example, if this joint had misaligned in a backward direction, we only want to push this joint forward. We want to leave all the other joints alone. And the Gonstead correction allows us to be very specific in its correction and pushing this joint to its exact location so we can get you better faster with less corrections. Like I just said earlier, an adjustment allows us to be very, very specific. We only want to move one joint that's affected. With the manipulation, what usually happens is it's a gross movement where we put our hand on all parts of the spine and we just cause multiple movement in many different directions. That's not ideal because we may, when you do that, you may upset other areas of the spine that are working perfectly okay.